Good afternoon, and welcome to the Editor's Podcast for the Journal of the Academy of Nutrition and Dietetics. I am Dr. Linda Snetselaar, Editor-in-Chief of the journal. This podcast today will focus on two upcoming issues on the topic of chrononutrition. And with me today, I have Dr. Krista Varady, who is a professor of nutrition at the University of Illinois, Chicago. Her research focuses on the efficacy of intermittent fasting for weight loss, weight maintenance, and metabolic disease risk reduction in obese adults. She has been studying fasting for over 15 years and is one of the top researchers in this field. Her work is funded by the National Institutes of Health, the American Heart Association, International Life Sciences Institute, and the University of Illinois. She has published over 80 articles on this topic and is also the author of a book for the general public, and it is entitled Every Other Day Diet. Welcome, Krista, and thank you for being with us today and for the work that you have done as guest editor for this theme issue, which, as I have said, will appear in two separate journal issues.
Great. Thank you for having me here.
Yes, and I am honored to interview you today on this exciting topic. So, to begin, my first question is, what do you consider the exciting points that are being made in the articles in which you serve as guest editor?
Well, it's been a really fun time pulling together this special issue and contacting authors I know in the field and kind of molding an issue that looks at a bunch of different kinds of research as well. So we're going to be having some randomized control trials published in the issue, cross-sectional studies, as well as some qualitative studies. But specifically, some of the ones I wanted to point out that I found most interesting. There's a really nice randomized control trial that will be published looking at whether or not time-restricted eating is safe in adolescents with type 2 diabetes. So this is a very novel area. Not many studies of intermittent fasting have been done in adolescents. And basically it shows that it is easy to do for this population group and it is feasible. Another one that I wanted to point out was a cross-sectional study of the effects of meal timing on sleep, because I know there's a lot of questions out there whether or not eating late at night really affects your sleep or not. And this cross-sectional study shows that eating later indeed does lead to worse sleep quality and sleep efficiency. So people essentially just don't sleep as well if they're eating kind of later into the day. And the authors don't know exactly why this is going on, but some things we've seen in our study is that if people are eating kind of later into the day and if they have like gastric reflux issues, it inhibits them from getting proper sleep or going to sleep well because they have all this food still like in their stomachs and the top half of their GI systems that kind of leads to that gastric reflux and that burning sensation. So it prevents them from sleeping well. So that's one of the issues. So generally the whole rule of like, don't eat anything after dinner, I think that's good for multiple things. Like it helps with insulin sensitivity, but it definitely seems to be helping with people getting better sleep as well. And lastly, I wanted to point out a qualitative study that looked at the feasibility of applying time-restricted eating in people with type 2 diabetes in clinical practice. So there's been a lot of clinicians I think are still really worried about intermittent fasting. And so they just wanted to kind of interview a lot of doctors in this area, a lot of endocrinologists, and see if they would want to apply this, and also interview patients with type 2 diabetes to see if they would be open to trying intermittent fasting as an alternative to standard care, which is usually just calorie counting or carb counting. And they found that the patients were very open to it. And we've actually seen this in our own studies. We just finished a study of time-restricted eating in people with type 2 diabetes. And we found that people really liked it. And this qualitative study shows the same thing. I think this patient population just gets so sick of being prescribed the same thing over and over again. It's always about carb counting and calorie counting. They get really burnt out of having to just always like record things in an app, like food intake in MyFitnessPal or whatever. So I think just limiting the eating window is such a clear, simple message that they're open to. The study also found that clinicians, most of them were open to it, but a kind of a medium percentage population of the clinicians falsely thought that time restricted eating leads to worse diet quality. And that's something that, yeah, I hear all the time, that it makes people, because you're eating in a shorter eating window, I think a lot of clinicians think that people are going to reach for really unhealthy foods because they've been fasting for 16 hours. And then when their 8-hour eating window starts, they're going to like immediately drive to McDonald's or something. But we've shown in our studies, and loads of other studies have shown, that diet quality is not affected. People tend to just kind of eat the same foods they were eating before, but they tend to just eat less of them within that shorter window. And yeah, those are the three that I wanted to point out that I thought were most exciting.
Thank you. I'm so happy that we're going to be looking at a variety of study designs, and in particular the RCT, the randomized control trial, I think is going to provide a lot of new information as well. So great job of selecting those authors and those researchers, Krista. And then my next question, when we're looking at chronic disease, why do you think this particular area is so important?
I think intermittent fasting, as I mentioned with the previous question, I think people just like it because it's different than what we've kind of historically prescribed people to do for weight loss or just health improvements. So historically, everyone's been obsessed with like macronutrients. In the 90s, it was all about lower fat diets and eliminating or consuming low fat products. And then we shifted to, low carbs. So the Atkins diet in the early 2000s, and, are just tracking calories in general. So I think it's just, again, like such a refreshing alternative for people. And it's so simple and easy to do. It doesn't require a lot of nutrition literacy for people that are still confused by nutrition labels. It's free, so for kind of underserved populations or lower resource populations, they don't have to buy expensive food products to do intermittent fasting. Really, it's like anyone who has access to the time can do these diets. So I think it's just really different, first of all, from what we've been studying and what we've been prescribing to people, and it's really highly accessible and simple. So I think it's yeah, that's why I think it's kind of getting a lot of attention these days. And I think it's probably one of the reasons we want to do the special issue on it. It's just people really like it and they're really interested in the research behind these diets.
Yes, I love your concept of the simplicity of doing something like this where you're doing time restricting. And I think that's often one of the areas that can be very difficult when we're doing research too, where compliance sort of comes up as being one of those more difficult things to achieve. So I love those points you're making about this particular concept related to chrononutrition. When we look at the future in terms of the topic of chrononutrition, what areas of research do you see coming up as we continue to do research in this area?
Yeah, there's lots of kind of hot topic areas that I think we still need a lot of studies in. First and foremost, I think in people with diabetes, we need a lot more studies. There's only, to date, from what I can see, about 5 randomized control trials conducted in people with type 2 diabetes, but they all show really favorable effects where people are lowering their A1C, they're losing a little bit of weight, they're not, and there's no negative effects either. So it doesn't lead to increased occurrences of hyper or hypoglycemia. And the patients seem to really like it. So I think diabetes is definitely a major area. We're actually running a study right now in type 1 diabetes as well, just to see for people that have obesity and type 1, if it can help them kind of manage their weight. And we're really looking at like safety issues here too, because obviously with type 1, there's the risk of ketoacidosis. So in our study, people are working very closely with their endocrinologist, but it does seem, we just started it, but it does seem to be working as well in that population group. I think the main thing that intermittent fasting helps out with is really improving glucoregulation, or basically just blood sugar regulation. So any diseases around that, I think, are getting a lot of attention. So polycystic ovarian syndrome, and that affects up to 15% of premenopausal women. And that is associated with insulin resistance, and it leads to obesity and all these issues with hormones. So they basically have high levels of androgens, so like testosterone, and that leads to a lot of the negative effects where they see like unwanted hair growth and acne and that type of thing. So I think we need some studies in that area to see if time-restricted eating, because it does, or any intermittent fasting regimen, if that can improve the kind of underlying insulin resistance and then help regulate hormone levels, so androgens. Cancer, the whole cancer intermittent fasting area is really starting to explode as well. So now what they're finding is that fasting for certain populations before chemotherapy can actually help people tolerate the chemotherapy better. Whether or not it actually improves the effectiveness of chemotherapy, is still a little unknown, but it definitely helps people become less nauseous. So I think that's an interesting area. And this has been shown primarily in women with breast cancer. I'm not a cancer researcher myself, but I know that there's a lot of other cancers, like GI cancers, that are also being tested. So colorectal cancer, there's currently studies, if you look at clinicaltrials.gov, and prostate cancer, and I believe I saw one even in bladder cancer. So yeah, I'd say mainly diseases related to insulin resistance, and then the cancer field as well.
Very, very interesting, and so incredibly important as we look at various populations too. Sometimes chemotherapy isn't as well accepted, or symptoms can be worse in older adults as well. And so some of these new approaches, I think, especially as we look at chrononutrition, can be incredibly important. And then my last question, what aspects of this particular research area should be important to practicing RDMs?
Yeah, I think there's a lot of misconceptions about intermittent fasting that I think a lot of dietitians already know that they're false, but just to clear up, just in case anyone is still a little confused. I think a lot of people believe that, as I mentioned before, that intermittent fasting leads to poor diet choices and worse diet quality, or even malnutrition. But this is not the case. If we look at randomized control trials and even cross-sectional studies, we don't see any negative effects on diet quality. So I think that's important for practicing RDNs to know. It is an effective diet. It basically just produces the same amount of weight loss as any dietary intervention. So about 5% weight loss after 6 months. And then in a lot of cases, we have seen intermittent fasting. It helps to lower blood pressure, LDL cholesterol, triglycerides. In people with diabetes, it has been shown to lower A1C by up to 1 point. So I think, it's definitely effective. And then also the diets are safe as well. I just want to point out that there's no literature showing that it increases the risk of eating disorders. I think it's kind of a hot topic, or that's what people are really worried about. I do have to say, though, that pretty much all studies of intermittent fasting exclude people with a history of eating disorders. I don't think these diets are really, I don't think it's safe in that population group. But in people that don't have a history of eating disorders, when we measure, symptoms of eating disorders, they do not increase over the course of the trial. And I'd also say I think some people are a little bit worried about excessive lean mass or muscle loss with these diets. And just to clarify that, I'm sure as a lot of RDNs already know that when anyone loses weight, about 75% of the weight loss is fat mass and about 25% is muscle mass if the person's just dieting and not combining that with exercise. And that's just the same for any diet out there. So it's the same for intermittent fasting, calorie restriction, low fat diets. They all, as your body size decreases, you're losing both fat and muscle mass. And you don't see any kind of extra muscle mass loss with intermittent fasting. So it's not, doesn't lead to sarcopenia or anything like that, even in older population groups. So I just wanted to point out, some of those issues that people are still a little confused about. We train RDs at our university, so I work with a lot of them, and that's usually what they ask about.
So thank you so much for providing these detailed ideas related to what RDNs might be thinking about as they're working with their clients. And just to put a finer point on this, I think this topic is incredibly important, not only to Academy members, but also to researchers out there wanting to do research in this area. That idea of timing around eating, I think, is going to be something that we look at more and more as we intervene with diet relative to chronic disease risk factors. And so thank you so much for responding to my questions. And I appreciate your time in participating in this podcast.
Thanks again.